Hello from Robert TV. We are continuing our series regarding heart disease. Um, we had previous recording regarding coronary disease and the function of the heart, quite basic stuff. But today we're going to talk about heart failure. Heart failure can be due to multiple reasons. The big ones are like coronary disease, which is due to the blockages in the arteries of the heart itself, or you can have a dysfunction of the heart muscle itself. The muscle you can see, the heart muscle, which is mostly the left ventricle, but obviously the right sided heart failure can also happen. So the muscular failure can be due to either the blood supply, which we talked about before. You have a blockage there and you have a heart attack, and then the damage to the heart muscle leads to the heart failure. And then the other causes of heart failure, obviously, the big ones are high blood pressure, and you have a valvular problems where you have either the leakiness of the valve or the valve is narrow, like in this case, if you have aortic stenosis, for example, that can lead to a heart failure as well. So, and also the rhythm problems, which includes atrial fibrillation, that can lead to heart failure as well. But today we're going to focus on heart failure because of coronary disease. As you can imagine, if somebody had a heart attack and the artery was blocked, in that case, you have heart attack, and if you are lucky enough to reach the hospital in time, then you can have a stent put in and the artery hopefully was open. But if you are unlucky and the heart attack was completed, in that case, the area, as we mentioned before, beyond that blockage would have been damaged. And if you take your medicine quite regularly, and there are certain precautions which we're going to talk about at the end of the program, then heart failure can be effectively controlled. So, with having said that, so let's talk about some of the symptoms of heart failure. So, once the heart starts to fail, then certainly one of the most common symptom is you feel shortness of breath, or you feel excessive fatigue. You are unable to do things which you used to do before. Now, the shortness of breath could be on moderate exertion, or on minimal exertion, or even at rest. So we have what we call a New York Heart Association classification. I don't want to go into a lot of technical jargon, but certainly if you are feeling shortness of breath on minimal exertion, then certainly there is something to be concerned. Some people have symptoms of heart failure while they're lying flat at night, and they wake up gasping for breath. And that's very significant, and that can lead to what we call as acute heart failure or impending pulmonary edema, which can lead to sudden death as well. So so the most common symptom is either you have fatigue, shortness of breath, excessive inability to do the daily activities, and then sometimes you can have a swelling of the legs. You can have sometimes palpitations, and many other a few other symptoms actually, which can signify that the heart is not pumping effectively. The this After the symptoms usually get worse if you have a very salty meal. If you went out for a Chinese food or some other, even Asian foods have a lot of salt, and if you end up eating those, you can uh, accumulate a significant amount of fluid inside your body, and that can lead to symptoms of heart failure. In almost all of those cases, the pumping, you can see the pumping itself of the left ventricle is affected. Normally you have a pumping which we regard as 55 to 60%, 70%, but then certainly sometime it once you reduce to 40, 45% or below that, you will have a significant symptoms. Also, the heart failure can be due to difficulty in relaxation of the muscle. We're going to talk about that as a separate heading. It's called diastolic dysfunction. What we're talking about today is a systolic function, where there is a pumping of the heart muscle itself, which is affected. So, and the treatment plan, obviously, most of these heart failure patients, if you have a coronary disease leading to heart failure, you will be, if you have a stent put in, you will be on aspirin or Plavix, we call as clopidogrel, or you will be on a medicine called Brilinta, and or affiant. So these are the most common what we call antiplatelet therapies, which are available for to prevent the occlusion of the stent. These medicines should be continued. You should not stop any of those medicines, especially if you have a stent put in recently within last year or so. Even if it's more than 1 year or 2 year, certainly you should consult your cardiologist before you can stop your aspirin or Plavix. So usually it's what we call as dual antiplatelet therapy. And then the specific heart failure medication include a water pill, which is, for example, Lasix or furosemide. You have to take it every day. Obviously, one of the good things should be that you take it in the morning, and this way, by the time it's the evening time, the effect is gone, and you're not waking up in the middle of the night to go to the bathroom. If you have to take your second pill of Lasix, take it around 2 o'clock. So this way, this can prevent any further um, issues, especially at night, so you don't wake up and the sleep is disturbed. Then most of the time we put patient on ACE inhibitors or a tablet called digoxin or lenoxin, and or beta blocker, which is either is carvedilol or toprol, or some of the other beta blocker can be used as well. The new heart failure medications like Entresto also quite useful. But obviously we don't want to go into a lot of technical issues with the medicine. But the most important aspect of controlling heart failure as a layperson is you have to take care of following things. Number one, your salt intake. It has to be minimum as bearable, because many people are stuck with the high salt diet and certainly don't want to lose their taste. But certainly you will see as you cut down your salt intake gradually, the high salt diet will look very not healthy, or you won't see feel that as good. So the taste bud actually just quite good and quite nicely and very quickly. In many cultures, salt is actually not part of their diet, so the less salt you take is better for you. Number two, please weigh yourself daily. It's crucially important. If your weight goes more than 2 pounds, then certainly take an extra pill. That means the water is being collected in your body, and that's not a good sign. You have to weigh yourself daily, and yourself in the same scale, same time of the day if possible, because this way you can understand and you can appreciate the accumulation of fluid much more quicker than with the weighing machine, which is different weighing machine and different time of the day. So this is very, very important. And the third aspect is that you try to lose weight if you have gained significant amount of weight, because the lighter you are, the less stress on your heart. And simple mathematics, so imagine if a building is made for a building has a pump which is made for 2 stories. You put 3 or 4 other stories on top of that, the pump is going to fail. It's the same concept. If your body is too heavy, the heart cannot take it anymore. So you have to make sure you make an effort to lose weight. This is very important. If you're diabetic, make sure you control your diabetes very, very effectively. With the heart failure symptoms, if you control your heart failure symptoms, and you are actually very, very careful with your diet and your medicines, we have seen people living even with advanced heart failure for many, many years, especially if the heart damage is mild to medium. So if you have a heart failure, this is not the end of life. It's not nothing to be despair, and don't be depressed. The treatment is available, is manageable, as long as you are willing to work with your doctor effectively. Thank you so much for your attention.